What is a burn? A burn is a type of injury associated with extreme temperature changes, chemicals, electricity, friction, or radiation.
Now that we know the definition of a burn, we're going to go over the 4 different types.
A first-degree burn is an epidermal burn, meaning it's superficial. It causes the skin to be red and dry. It doesn't cause blisters. It's painful, and it heals within 3 to 5 days.
I'm going to get a windburn.
Oh, hi there. I'm going to tell you a little bit about second-degree burns. Second-degree burns are partial or full-thickness burns, which include the epidermis and the upper layers of the dermis. They leave the skin red, painful, and full of blisters, and will not heal for 10 to 21 days without a skin graft. Some examples include really long exposure to the sun, touching the stove, curling iron, or even that hair straightener that you like to use so much.
You know, Lindsay, we really got to get you away from these boys. These boys are bad for you. He's going to cheat on you again. He's a terrible person. Boys, they're horrible. You know, one time I was dating this jerk. He was a horrible person. Oh, I'm sorry, sweetie. I'm so sorry. Top of the morning to you, class. I'm here to talk to you about third-degree burns. Third-degree burns are a full-thickness burn, and they involve all the layers of the skin, including your subcutaneous fat. There's no pain at the site of this burn because all of your pain receptors have been destroyed. In order to fix this horrible injury, you're going to have to get skin grafts. And sadly, our young Lindsay over here has not learned the difference between safety and unsafe, because she is about to stick her finger in a light socket, which could possibly lead to a third-degree burn, not to mention electrocution.
I'm here to talk to you about burns of the 4th degree. They're much like third-degree burns of the 3rd degree. It's a full-thickness burn. A 4th-degree burn is the most severe burn, and it burns all the way down to muscle and bone.
Many complications can arise from receiving a burn. For starters, you are more susceptible to infection because of the open sore. You are more prone to scarring because your tissue is now damaged. Typically, you will go into shock because of the blood loss. Nerve damage is commonly seen in burn victims. Hypothermia also plays a role. Your skin is a temperature regulator, and if there is a problem, your body can no longer regulate its temperature. Therefore, you can develop hypothermia. After the burn is healed, people typically will have some sort of sensory deficit.
Here are a few different ways that you can receive a burn. You can get a temperature burn, hot or cold, and these can be received from dealing with fire or getting frostbite in extremely cold situations. An electrical burn can be received via contact with electrical sources. A chemical burn can be received via contact with certain chemicals. Radiation burns from dealing with radioactive materials, such as X-rays or radiation treatment for cancer, or even UV rays from the sun. And lastly, friction burns, such as a rug burn or road rash.
And now, we are going to demonstrate the appropriate way to respond in an emergency burn situation.
I love cooking in the morning breakfast for everybody. I can't wait for them to try my eggs.
Hey, what are you making?
I think I burned my hand. What do?
The first step is going to be to check the scene for safety and to ask the person if they are okay.
What do?
I'm checking the scene. I'm in my kitchen. The scene is safe. Are you okay?
My hand's burnt. Badly.
Step 2.
Cool the burn until the pain has started to subside.
Oh, gee willikers, we have to cool your burn.
Next, you need to dress the area. First, you need to make sure that the wounded area is dry and remains sterile. You do not want to use any of that nasty antibiotic ointment because it can lead to further infection. Lastly, you need to make sure that when you wrap the area, you wrap it loosely to prevent any further injury later on. Using these supplies, you will wrap the affected area loosely.
Okay, now that your burn is clean and dry, I'm going to wrap it loosely with this gauze here. Let me put my gloves on first so we can stay sterile.
What if you put some of this ointment on my hand? Will that help?
Well, we really shouldn't do that because that can cause some infection and it can also delay your healing. I'm taking my gauze here and I'm going to put it on your hand. All right? I want to wrap it up though, not too tight, just enough to protect the burn. Is that too tight?
No.
No?
No, it's okay.
Okay. All right, almost done.
How long is this roll?
It is a very long roll. I think because of how bad this burn is, we might have to take you to the hospital to get it looked at.
Even after dressing the wound appropriately, if the burn is severe, you must still call 911. It's important to call 911 or make sure that the person seeks medical attention. If the burn was very severe or life-threatening, you need to call 911 before caring for the wound.
Okay, class, in conclusion, remember there are different severities of burns as well as different methods of getting burned. When responding to a burn victim, just check the scene. Next, remove the person from the source of the burn and cool it under running water. Make sure to dress the wound loosely and then seek further medical attention.
Be the best you that you can be.
Only you can prevent forest fires.
Stay classy, San Diego.
Whoa.
Well,
Oh my God, Austin, we have to cool your burn. What the?
What? I didn't.
Oh my God, Austin, we have to cool your burn. Oh boy, Austin, we have to cool your burn.